Thyroid and diabetes, very common issues today. Let's talk about them. I'm Dr. Aradhya Achuri, fertility specialist at Apollo Kondapur.
Hi, I am Uzma Khan, consultant in endocrinology at Apollo Hospitals. So today we are discussing about thyroid, a very common condition. So thank you for having me, Dr. Aradhya.
Thank you for your time, ma'am. One of the most common questions that we get asked is, what should I look for? If I'm suspecting I have thyroid issue, what are the signs and symptoms that let me know that I have some issue?
Symptoms of underactive thyroid or hypothyroidism, which is the most common condition related to thyroid, are non-specific. So people may present with a little bit of weight gain, tiredness, some hair fall, or dry skin, period irregularities in females, and difficulty conceiving. So we suggest having a test done anyway every 1 to 2 years, as the initial symptoms, as I said, that we don't see any symptoms. In advanced stages, when the thyroid functions are too bad or worse, then the symptoms are more prominent. And for the overactive thyroid, which is a bit less common than underactive thyroid, we can see symptoms of unexplained weight loss, shaking, sweating, heart rate going up, and period irregularities again, and difficulty conceiving.
So it is very important for us to note here that don't wait for symptoms or signs to develop.
Yeah.
Regular screening every year or every 2 years is what madam wants us to do. What if the TSH is borderline, like subclinical hypothyroidism? Whom do you want to get treated?
So, subclinical hypothyroidism is a condition where the main hormones T4 and T3, they are normal. Only the response or feedback hormone, which is secreted from the pituitary gland, is elevated, because that is the hormone which first goes up, telling us that there is some abnormality in the thyroid gland. So, if the TSH is mildly elevated, so somewhere between the upper limit to up to 10, we can wait and watch in most people. But certain people with autoimmune issue like autoimmune thyroiditis, which is Hashimoto's, where the antibodies are positive, there we would recommend treatment even before the TSH goes above 10. Otherwise, above 10 is the cutoff where we would start treatment in subclinical hypothyroidism. Above 20, generally, it is an overt stage where the T4 and T3 start going low. So, above 10 or below 10, if there is antibody positivity, or in reproductive age females or males planning pregnancy, we'll be starting treatment. And in symptomatic individuals, so sometimes too much of weight gain, unexplained, or non-specific symptoms but not attributable to other causes, so then we would start treatment in those people. Yeah.
Treatment varies from person to person. It depends on their age, their symptoms, their antibody levels. So you have to always consult an endocrinologist and get their opinion before starting your treatment. How does this thyroid affect people who are planning pregnancy or already pregnant?
Yeah, so it's very important that we check thyroid functions before someone is planning pregnancy, as underactive thyroid needs treatment with levothyroxine before planning pregnancy if it is diagnosed. And it's very important, as fertility can get affected, so they may find it difficult to conceive, or there may be chances of miscarriages, especially in conditions where some antibodies are present to the thyroid gland, like Hashimoto's thyroiditis. And once they get pregnant, the fetus or the baby is fully dependent on mother for the initial 18-20 weeks of pregnancy for its thyroxine requirement for its growth and especially neurological development. So it's very important that if there is a thyroid problem, hypothyroidism, we replace it appropriately and monitor the tests, and keep the TSH, which is the main test, in the normal pregnancy related targets. And for the overactive thyroid, also it's even more important, because we can't give some of the medicines which we give for overactive thyroid in pregnancy, as they can be associated with some birth defects. So we have to ideally treat and stop the medicines before they conceive. But I think we are talking generally about the underactive situation, which we come across routinely. So it's checking before pregnancy, treating it appropriately, and then monitoring and keeping it within target.
So if you're planning pregnancy or you're already pregnant, it is very important to check your thyroid levels. So we have tested and we have started somebody on thyroid medicines. Is there a chance that their levels can still fluctuate while on medication?
Yeah, so it's very important that people take the tablets daily, because the most common cause of fluctuating thyroid hormone levels is that people are missing their doses. So if they are taking regularly, and then also we do come across fluctuations if they are having some food or drinks within especially 30 minutes of taking the tablet. So ideally an hour or at least 30 minutes gap has to be given between the tablet and their breakfast, tea, coffee, any beverages. And apart from that, we do come across some medicines like iron supplements and calcium supplements, if taken within 4 hours of the thyroid tablet, can affect the absorption of the thyroxine tablet. So those should be spaced by more than 4 hours, and ideally taken after lunch or dinner. Then some people are antacid medicines, which can also affect absorption of thyroid, as the acidic environment of the stomach is needed for the absorption of thyroid tablet. So apart from that, there are some seasonal variations also in TSH. So it's important that we keep checking and monitoring and not leave it for 6 12 months without getting a thyroid check whilst on treatment.
So it's not enough that you have had it evaluated. You need to go back for your regular screening, be in touch with your endocrinologist, and keep getting this test repeatedly. When is the best time to test their thyroid levels?
So the best time is, ideally it should be done at the same time, because we are comparing the previous levels to the current. So morning fasting, 8 to 10 a.m. And if we are checking a T4 also, then we do it before tablet if possible, along with the TSH. Because at the same time, there is variation in the T4 level with what time they had taken the last dose. So morning before tablet would be the advice if it is a full profile. Only TSH can be checked just fasting without the need for before or after tablet, doesn't matter in that case.
Before tablet or after tablet? This is a very common doubt everybody has when they're checking their thyroid levels. Can you please confirm what is the best time to check?
Yeah, so for TSH, if we are checking, because that is the main test for hypothyroidism. So TSH is a fasted, ideally 8 to 10 a.m. morning sample. So tablet before or after doesn't matter for the TSH test, because it's an average of 6 to 8 weeks. So the day whether you have taken tablet or not doesn't matter. But if we are checking the T4 levels, the free T4, which we specialists commonly do, so that depends on when the tablet was taken. So before tablet, I advise, as it is the lowest level before the next dose, and the tablet takes some time to get absorbed. So after 2 3 hours, I say 3 4 hours later, it is like fully. Means fully can be interpreted and absorbed. So in the blood, we can check T4 later if you are checking only T4. But both together, I do it fasted and before taking the tablet.
That's a very important point because many people are anxious about doing the test. It really doesn't matter. Make sure you're getting your test on time, and that is all that matters. When we suggest thyroid medication to somebody, they're very anxious to start this because they think that once they start the thyroid medication, they have to use it lifelong. Is that true?
No, so it depends on what is the cause of hypothyroidism. So, real thyroid issue, which is more common one, is the autoimmune hypothyroidism or Hashimoto's thyroiditis. So that condition is a progressive condition. So whatever we do, lifestyle, weight loss, it won't improve because it is a progressive condition. We don't have any treatment for autoimmune thyroid condition. So the gland gets progressively affected. So we have to start treatment, and the treatment we are giving is a hormone replacement. So it's not that once treatment is started, the people get dependent on the hormone. It depends on what is the deficiency level. Sometimes borderline hypothyroidism can improve on its own. In 50% of the cases over 1 to 2 years, the subclinical hypothyroidism can improve, especially without the antibody positivity one. So unexplained causes and all. So it depends on what is the cause of hypothyroidism. Iodine deficiency used to be the most common cause earlier, and now we have started to use iodized salt since many decades, and we have overcome that. So it's very important that people use iodized salt. If they were not using and then they switch back to iodized salt, then also the thyroid functions improve.
So before you jump to YouTube hacks or Instagram hacks, and you do need to concentrate on your lifestyle, but knowing the cause of your thyroid dysfunction is what matters. If it is something like autoimmune, like Madam has said, you will require medication, and not taking medication will only complicate your life and not make it easier. What about weight? Can weight loss help them in improving their thyroid disease?
So weight loss does help in high TSH. Subclinical hypothyroidism biochemically is slightly elevated TSH. In people with higher BMI, especially obesity class 2 and 3, their TSH is a bit higher because TSH is a weight based parameter, and for higher weight individuals, the TSH is a bit high. So when these people lose weight, their TSH improves or comes down. But people with normal BMI or mild obesity, even if they lose weight, it doesn't help, especially if it is an autoimmune problem, which is the most common cause nowadays for hypothyroidism, underactive thyroid.
Good to know that. India is one of the diabetes capitals in the entire world. Diabetes is so common today, we are seeing this even in men and women in their early 30s. What is your experience, ma'am? Do you think the prevalence of diabetes is increasing in this generation?
Yeah, definitely. We are seeing diabetes now in younger generation and even in the 20s and 30s. So we are ethnically also predisposed. All the South Asians, we have this thin fat phenotype where we collect more ectopic fat in the central area, causing more insulin resistance. Then we are born with less beta cell mass. So we have some insulin deficiency also from the beginning, so we are like genetically disadvantaged, I would say. So and on top of that, we have this sedentary behavior and lifestyle, and food choices are not good. We have so much of like processed food, and sedentary behavior is on the rise.
We are already genetically predisposed to get diabetes. You should not add on your sedentary lifestyle and your eating habits and make it worsen. If you can take better care of your health, you're physically active, you watch your diet, there is a chance that you can escape this diabetes at least till in your 50s. What are the early signs of diabetes that people often miss?
Yeah, so there are various risk factors for developing diabetes. So, if someone has family history and they are gaining a lot of weight, especially weight in the midsection, and they find having some dark patches, fleshy sort of pigmentation at the back of the neck, underarms, and all, so that tells us that there is an insulin resistance issue going on. And as the diabetes or the predisposition to diabetes moves from normoglycemia or normal glucose to borderline to full blown diabetes, the later on signs develop, but like increased thirst, losing weight, feeling thirsty all the time, passing more urine. So those are a bit later symptoms when the glucose reaches higher levels like 300 or more. But the early signs would be like the risk factors basically. And unless the glucose is very high, we don't see more severe symptoms of diabetes. So it's very important that we screen for diabetes, meaning that we check for it even without symptoms developing.
Listen to your body. Your body will always tell you when it is unhappy with you. Any changes in your normal routine, any changes in the skin, this should not be ignored. Always meet a doctor, get the test that they advise, and go back and show these reports to your doctor. I see many people who get the screening test every year, but they never go back and show the doctor and
Mm-mm.
find out what has to be changed in their lifestyle.
Yeah, skin infections are also a common thing. So, unexplained infections in
Hmm.
urine and the skin. So, those are also warning signs to get the glucose levels checked.
So once we have tested and we have seen that the patient is diabetic, we ask them to take medication, but they are not keen on medication because they think that once they start this medication, they have to use it throughout their life.
Mhm.
Is there any possibility that diabetes can be reversed?
Yeah, so that is a very common question. We come across that. So, in individuals who have type 2 diabetes and there is insulin resistance related to excess adiposity, which is excess fat accumulation, especially in the midsection, central obesity, we call it. So, if those people lose weight, then their insulin resistance improves. So, insulin resistance means that the insulin is there but unable to act properly. The job of the hormone insulin is to take the glucose from the blood to the body cells, and it won't act properly if there is a lot of fat inside the organs like liver and pancreas. So, when these people who have insulin resistance, if they lose weight, their diabetes can go into remission. We don't use the term reversal because it can't be reversed. It can always come back again with weight regain. But remission means that it can be like
Control.
controlled or come to a point of no diabetes, but with weight loss. So there is a difference between remission of diabetes and control of diabetes. So control means that if people are following diet and low carbohydrate and they can control their glucose. But remission means that even if they have high carbohydrate, then also if the glucose is normal, that means the pathophysiology has improved, then it is called remission. So there is something called diet control diabetes and remission of diabetes, and these two are different.
If you are somebody who doesn't want to take medications for diabetes, make sure you follow a healthy diet, be physically active, get your screening test done properly, consult your doctor, take their suggestions, be in touch with a dietitian, and if you can follow a good diet, your diabetes can be in remission. This is the good news that madam has given us. Sugar free, this is a tag we see for many of the supplements that are now available commercially. What does this sugar free mean? Are they actually safe?
So sugar free, there are different versions of sugar free. So it depends on the label because sometimes they may say no added sugar, but there may be some sugar in some hidden form into that formula. So we have to see what exactly there is in it. So the sweeteners, which are like alternatives to sugar, some of them are FDA approved. So the FDA has approved some sweeteners for use, but they should be used in moderation. So people, if they're having a lot of these sweetened beverages and all, they tend to gain a lot of weight because there is a signaling and then insulin resistance is linked with it. Sometimes people get diabetes because of overuse of these things, as they can disrupt the intestinal flora and gut microbiota. And then some studies have pointed towards some cardiovascular risk as well and metabolic risk. So in moderation, once in a while, I would say, not use very regularly. I think going for like something without sugar is the ideal thing, or plant based sweeteners like stevia, monk fruit, erythritol, these ones sugar alcohols. I think if taken in moderation, they are okay, but they can cause bloating, indigestion in some people.
Not all sugar free are really sugar free. Check the ingredients properly. Don't go blindly by what is written on the cover. What's more important, fasting blood sugar or HbA1c?
So yes, both of them actually they have a role. So HbA1c is like a, overall picture it gives us over the last 2 3 months what the glucose level has been, and fasting glucose is a snapshot. So in people who are on insulin and we have to like adjust their doses, fasting and even post meal, they are useful, those values. But for overall glycemic control, HbA1c gives us an idea. But in some cases, like when the hemoglobin is low in anemic individuals and people with chronic kidney diseases, HbA1c is not accurate. Even in pregnancy, the HbA1c goes low. So it's not accurate in those cases. Then fasting is more important. And the other thing to know is that people with obesity and fatty liver, which is metabolic dysfunction associated fatty liver disease, they have early onset impaired fasting glucose because the liver produces a lot of glucose even when we are not eating overnight. So that may be a sign of fatty liver problem and insulin resistance. So both have their like role, and we would use them in combination rather than either of them.
So some people fast for 15, 16 hours and give their FBS test and say that my sugars are completely normal. What is the ideal duration that should be maintained when they are giving this FBS test?
So minimum is 8 hours of fasting, or means I go for a 10 hour because with 8 hours sometimes it may not be exact. So I would say not more than 12 and not less than 8. So around 10 hours is a good like balance. But yeah, 8 to 12 hours, not more than that, I would suggest. Because in routine practice, practical scenario, we can't exactly go for exact number of hours. So somewhere between 8 and 12 is okay to take it as a fasting glucose.
If you're doing it as a regular screening test, HbA1c would probably give you more information. But if you're somebody who is already diabetic, under treatment, or under lifestyle changes, doing a fasting blood sugar will give your doctor more information. Many patients with PCOS also have insulin resistance. And how do you think they both match? Does having PCOS increase the risk of having diabetes later on?
Yes, PCOS and insulin resistance both are a risk factor for type 2 diabetes. And it is linked more with higher BMI or obesity. And we come across these like signs like dark patches at the back of neck and fat in the central area, so that tells that that person has insulin resistance, and that can disrupt the egg release at the right time, and that's why period irregularity we see in PCOS. So yes, insulin resistance is linked with ovulation issues, and it can it is, as we know, it is one of the causes of type 2 diabetes as well. So all three are linked with each other. They are metabolic issues.
This is the reason we advise metformin for many of our
Yeah.
patients with
Yeah.
PCOS. But the minute they go to the pharmacy guy says, Madam, this is for somebody with
Sugar.
sugar. You are
Yeah.
so young. Why are you taking this?
Yeah.
And the patient either stops taking the medicine or they
Mm.
stop going to the doctor.
Yeah.
Many patients with PCOS have conceived naturally, spontaneously
Yeah,
on their own
metformin.
after starting metformin. We are not trying to treat your diabetes. You are not diabetic, but they have the same pathophysiology. They still have the same insulin resistance as somebody with diabetes. That is why we prescribe metformin, and many people conceive naturally after starting metformin. Can lean PCOS patients still have insulin resistance?
Yes, so we do see about 50% of normal BMI PCOS, they have insulin resistance. So it's important we have some tests, and the signs are those dark patches. The medical term is acanthosis nigricans, fleshy sort of discoloration at the back of neck and in armpits. So yes, that is seen in normal BMI PCOS as well. And in that also, in that condition, we can treat insulin resistance by way of diet, lifestyle, weight loss, and metformin, inositol supplements. They can be used in normal BMI individuals also, but we have to identify whether they have insulin resistance or not by clinical examination and some blood tests.
Many people who have this dark patches, when they manage to lose like 5 to 10% of their body weight, their skin actually clears up. You don't need a test to see if your insulin resistance is better or not. Your mirror will tell that for you. So what is the best treatment for these people with insulin resistance? Is it diet? Is it exercise? Is it medication? What would give them a sustained benefit and a faster benefit?
Mhm. So diet and lifestyle. to induce weight loss. So 5% minimum, ideally 7 to 10% weight loss can achieve improvement in insulin resistance. So medication, they will help as long as we give them. But if the weight loss doesn't happen, then we just have to keep using the medication, because they are not going to cure insulin resistance. We don't have any cure in terms of medicine, like we use antibiotics and cure infections. It's not like that. So weight loss is going to help with that, and that can be achieved with diet, lifestyle, and sometimes with help of weight loss medication.
So when we see a patient with insulin resistance and we tell them you need to manage your weight, you need to start working out, you need to take these medications, you will see better improvement in your overall health condition. Then the next question that we get is how long? How long will it take for my insulin resistance to get better?
So 3 months is a general sort of thing it takes, but once they start losing weight, improvement in glucose levels, we can see within few weeks also. But 3 months is a general sort of thing, but cellular level and more like long term improvement will be seen in like 4 to 6 months if they lose weight.
So you have joined a gym or a yoga class, you have gone for 3 weeks, and then don't come back to your doctor and say that I have been working so hard, I have not seen any improvement. You have to be consistent with your efforts for at least 6 months before you can see a substantial improvement in your insulin resistance. Weight loss injections, this is the rage in the country right now. Who should take this?
So, the ideal candidate for weight loss medication would be someone who has already tried dietary and lifestyle interventions and managed to lose some weight and regained, or did not lose enough weight but is motivated enough to continue with the dietary and lifestyle interventions. So, the medication are not a quick fix, they are not exclusive of diet and lifestyle modification. So, that is the baseline: dietary and lifestyle modification, exercises. On top of that, medication can help create a calorie deficit. So to induce weight loss, we have to create some calorie deficit so that the body uses stored fat if it is not getting the energy for day to day work, and if we are eating less than what we should, then it will use the stored fat. So to help eat less, the weight loss medication, they help with that, but they are not going to take calories out of food. So food restriction will have to be there, and those people should be motivated, and because medicines, at some point we may be reducing and stopping those medications. So diet lifestyle has to continue long term, and those people who have other complications related to excess weight, like uncontrolled diabetes, high blood pressure, fatty liver issues, sleep apnea. So they also will get help if they lose weight. Those things can improve those medical complications of obesity. And then, if someone is planning pregnancy and fertility is an issue, a fertility problem linked with PCOS and obesity, they can achieve weight loss with those medication, but we have to stop them before they start trying to conceive. So there are other groups as well, but these are like the common indications.
So we see patients who tell us that, Madam, I barely eat anything. I eat only once a day, but I'm still not able to lose weight. Will these injections help such sort of people?
So these injections help via reducing hunger, making people full, and that food noise or cravings, they are reduced. So if they are already eating very less, then it's very difficult. Sometimes people, they don't realize what they are eating. So most of the times that is the problem. At least giving those medication will give them some satisfaction that there is something helping them in achieving weight loss. But the calorie deficit is the main thing which these medication help in achieving, by reducing appetite, and whatever we eat stays in the stomach for long, doesn't pass quickly, so they feel full, bloated, nauseous sometimes. So and yeah, people who are very fond of eating, food cravings and all. So they help with these, and then they can achieve that caloric deficit. And it's very important to understand that the caloric deficit is not a long term thing that they have to keep eating less throughout. So it's for depending on how much weight loss we are trying to achieve. It can be 3 4 months or more for a very high BMI, or less for a lesser BMI. So some caloric deficit has to be created. At the same time, we have to make sure that protein intake is good and strength training is there. Otherwise, lean muscle mass loss can happen. And later on, that can reduce the basal metabolic rate, and people may just regain weight. There is metabolic adaptation after people lose weight, and there is a significant tendency to regain the weight. So, these medications even help in avoiding the weight regain.
Irrespective of what treatment you are getting to lose weight or control your diabetes, the main treatment is always your diet and exercise. As long as you're maintaining a good diet and following a good routine in your physical activity, the treatment, the medication that your doctor has to give you will come down. So you should always concentrate on that. We have had some patients who have tried a lot, they have followed diet, they've started going to the gym, but no matter what they do, they're not able to lose weight. And when we advise them to take these injections, they're scared of the side effects. What are the side effects that can occur in these situations?
So when we start these medication called GLP-1 receptor agonist, or the dual agonist GLP-1 and GIP receptor agonist, they act via our brain centers, reducing appetite, and also the emptying of the food from the stomach to the intestine, that is reduced. So when that happens, people can get nausea, bloating, sometimes diarrhea, some abdominal cramps. So most of the times these side effects are milder because we start on a low dose, and they settle after a few days. And those symptoms can recur when we are increasing the dose, but then also they settle after a few days. Very rarely we have prolonged symptoms or side effects. So these are transient only.
Is there any situation where these drugs can cause a prolonged illness or something that affects their life even later on?
There are no long-term issues actually. So when we are starting these medication, we should take a proper past medical history. So if there is any pancreatitis in the past, we should not be prescribing these medicines. If someone already has some gastrointestinal problems or surgeries, gastrointestinal surgeries, the risk of bowel obstruction or ileus where the bowel doesn't move enough. So in those situations, we won't be starting these medications. So, if we choose the people who are candidates for these medication appropriately, we should not be having any trouble. And gallstone disease is a common condition, and it can get aggravated on these medications. So, we have to be cautious. We can still use, but we have to be careful and explain thoroughly, and be careful to watch for symptoms. So, any inflammatory like cholecystitis or inflammation of the gallbladder symptoms occur, then it is a emergency, like a surgical emergency, and the doctors would have to do surgery. So in those situations, we'll be a bit careful and explain whether someone wants to go ahead with those medication, and then it is a risk versus benefit discussion.
So the take home is always take these injections from a certified doctor. You can't go just to a wellness clinic and take it randomly just because you want to lose weight. It has to be prescribed by a doctor who has checked your entire history. And number two, always disclose your entire medical history. If you have had a bariatric surgery in the past, it's a good point that you need to mention this to your doctor. Before these injections came into place, bariatric surgery was a go to surgical treatment for people who are trying to lose a lot of weight. But what happens after a bariatric surgery? Can these people again gain that weight?
Yeah, so it's very common to see weight regain after bariatric surgery. So it is similar to like other diet lifestyle intervention where we create a calorie deficit, and then when people again restart eating, then it comes back. So with bariatric surgery also, the appetite and all returns, and people can eat small amount graze throughout the day and then regain weight. So in those situations, also we have some treatment for that. For weight regain, we have the newer weight loss medications which can be used. We were using liraglutide daily also, but now we have the weekly preparations, and they have cardiovascular benefit as well, like semaglutide and tirzepatide. So we can use these medication after bariatric surgery, not just immediately, after some time when we see that the weight regain is starting and can't be managed with dietary lifestyle intervention alone. There is too much hunger or craving.
So if you had a bariatric surgery but you still put on weight after 3 4 years, don't get depressed. You still have an option of using these weight loss injections to lose weight. One best diet for insulin resistance.
So there's no one best diet, but a diet containing whole grain, lean protein, healthy fats, and fiber. Something like a Mediterranean diet. That would be an ideal diet for insulin resistance.
Worst breakfast habit for diabetics.
So skipping breakfast is the worst habit. The other is having refined carbs like upama, poha, or just the white rice sort of thing. So refined carbs without enough protein, like egg whites are protein sources, or curd, or some nuts, seeds, and other protein sources. So if we just have refined carbs, and that is going to spike the blood glucose. So that is one of the bad habits.
Poha lovers, you need to watch this.
So poha, I'm not against poha, but we need to have more of protein, and less amount of poha is okay. So if it is combined with adequate protein fiber, then in portion control poha we can have combined with other things.
Thyroid patients need to avoid soy. Is this a myth or fact?
It's a myth. So, thyroid patients, so hypothyroidism on levothyroxine replacement, the thyroid tablet, they should be not having soy in the morning or early hours, like early lunch, but they can have a bit later in the day because soy can interfere with absorption of the thyroid tablet. But otherwise, there is no problem in eating soy.
Timing matters.
Yeah.
Best exercise for reversing insulin resistance.
So it would be a combination of cardio or aerobic exercises and strength training. So we have evidence that a combination of these exercises, so aerobic exercise like cycling, brisk walking, and then strength training like resistance training, weight bearing exercises, including body weight, free weights, or in the gym. So combination of these would help improve insulin resistance.
Rice, roti, millets. What's best for diabetics?
So whole grain, so whole wheat roti, and that too in moderation and combined with some protein source and fiber is best. Even rice, not the white rice. So compared to white rice, the roti is much better. Whole grain, millet based rotis or millet. But even rice, brown variety or very thick varieties of rice, they can be had, but always combined with protein and fiber in each meal.
Can skipping meals worsen insulin resistance?
Yes, it can. So when there is very less glucose, when people are skipping meal, then as a response, the body tries to increase glucose levels by increasing some other hormones response, counter regulatory hormones we call them. And because of that spike in glucose, because of low sugar, insulin release is there. And when people are not eating for a long time, they eat a lot of food at one time later on because of increased hunger, and because eating too much later on can again cause an insulin spike. So the more insulin spikes happen, the more the worsening of insulin resistance occurs.
So you don't have to skip meals to lose weight. Eat proper, eat moderate quantities multiple times a day instead of starving the entire day and then binge eating in the night. One lab test that everybody with weight issues should do.
Yeah, so from hormone standpoint, it would be TSH for thyroid hormone. And from metabolic standpoint, it would be a combination of tests, a glucose test and a lipid profile. And LFT is also very important as we see more of fatty liver problem, which is linked with insulin resistance.
Regular screening is a must. Are cheat meals okay in diabetics?
Yes, all of us should be allowed to have a cheat meal once in a while. So, in moderation, and if we compensate by having a walk after a high carb meal, so that is doable, but once in a while only. As persistent or multiple or repeatedly, if we do that, then it is definitely going to impact on glucose levels and cause uncontrolled diabetes related problems.
Enjoy your festivals, but do walk after that. Fruits, friends or foe in insulin resistance?
Yeah, so some fruits which are antioxidant and fiber rich, like berries, citrus fruits, guavas, pears, and apples. So they are good. They can we can have. Means people with diabetes can have them, but high fructose containing fruits like grapes or tropical fruits like mangoes or dried fruits like raisins and these dates and all. So those are foes, or they would increase the glucose level. So some fruits are friends and some foes.
One habit that can destroy your metabolism.
So not moving enough or having sedentary behavior can destroy our health, as prolonged sitting and not moving is linked to adverse cardiovascular health and metabolic health. So we need to move throughout the day. If we can manage movement, that is the best.
Even if you're somebody with a very hectic schedule, make sure you stand up from your chair once in half an hour, walk around for at least 2 minutes, drink
Yes.
some water, then come back and sit at your desk.